Hello, today we'll be discussing our body exercise program for people living with diabetes. This is me, Anjali Chauhan, and this is my group, Ashutosh Trivedi, Jay Rawal, and Krishna Polra. The purpose of the program is we are focusing on diabetes, which enhances improving cardiovascular fitness, strength, and flexibility. It also focuses on blood sugar levels and promoting with management and reducing the risk of complications also. This program also supports better coordination, balance, and energy system for efficiency. You know what is diabetes? Diabetes is defined as a metabolic disorder which is caused in the impairment of insulin secretion in our pancreas, which is defective insulin action. Like sometimes it comes with a more, sometimes it doesn't gets their requirement done. And it can be both. So, chronic hyperglycemia is also associated with specific long-term microvascular complications, like it affects your retina of the eyes, kidneys, nerves, livers, and also cardiovascular diseases as stroke and heart failure, heart attacks also. So, in Canada, the World Diabetes Day is celebrated in November 14th, which says diabetic awareness of the month in November to prevent diabetes and get more awareness about the diabetes. Especially there are three major types of diabetes. First one is diabetes 1, which is autoimmune, which is just possessed by the body. And in that, the pancreas are not producing or little bit of production there in the of the insulin, which leads to lifelong insulin therapy. Whereas the type 2 diabetes is most common, where the body becomes resistant to the insulin. Means it's not producing enough kind of insulin which is required by the body. That is due to many lifestyle factors and genetics. Last but not the least is gestational diabetes, which is develops in the pregnancy period around like after the birth or increases the risk after that of developing type 2 diabetes. And here are the some type like differentiation between type 1 and type 2, and as you can see in the diagram, it is clearly mentioned for all the types.
Hello, my name is Krishna Pora. Statistic about the diabetes. So, almost 1 in 10 Canadian aged 20 years and older has diagnosed with diabetes. And the prevalence of the diabetes range from 1% of Canadian age 20 to 39 and almost 1 in 5 senior age group 60 to 79. So in Canada, according to Canadian Health Measure Survey, the men are more prevalent than Canadian women. So next one is exercise guideline for people with diabetes. So aim for 150 minutes of moderate intensity exercise once in a week. 2 to 3 times per week strength training and perform flexibility and balance exercise 2 to 3 times per week. For example, stretching and yoga. Next one is what are the benefits of this exercise? So it improve balance. So it reduce fall risk and improve mobility. And another is the strength, builds your muscles, improving insulin sensitivity. The next one is flexibility, which enhance joint health and range of motion. And the next one is endurance, so which is helps to control blood sugar and support heart health. Next one is holistic health tips for diabetes. So sleep, 7 to 9 hours of quality sleep per night. Sedentary behavior, limit sitting time and stand or walk every 30 minutes. And nutrition, so follow a balanced diet rich in whole grain, lean protein, fruits and vegetables. And these are some resources for diabetes management. The next one is exercise program for diabetes management.
Hello, my name is Jay Rawal. And so I will be describing about the exercise program we created for the diabetes management. So this is on the basis of the Canadian guidelines for the exercise for older adults. So basically, four type of exercises are included. One is aerobic exercise. So it's, for example, walking, cycling, and it should be done like 5 days per week. And the minimum duration is like 30 minutes per session. So if you're walking with a dog or like you're walking alone or jogging in a park, it should be like around 30-minute session. Also, this exercise focuses on your limiting your blood sugar levels, and it's good for your cardiovascular health. So your heart pumps blood very easily, and they are not it's don't have to rush up or don't have to stress your heart. The other exercise is strength training exercise. So basically, what we do is lifting weights using resistant bands. This exercise is a bit a heavy type of exercise. So one have to do this exercise like 2 to 3 days per week, and the time duration for this exercise is 30 to 45 minutes because it warms your body up, and it targets major muscles like biceps, pecs, glutes, the major muscle groups. So and it's good for your health, like muscle strengthening power. Also, they provide good insulin sensitivity. Another exercise is flexibility exercise. So stretching and yoga, these are included in this type of exercise. And this is also the same. We have to do like 2 to 3 times per day, uh, and 3 days per week. So and because the duration of this exercise is very less, like 10 to 15 minutes. So one can include this exercise twice in a day also, because flexibility stretching is important for everyone. Like if someone is a household person, like housewives, someone is like a working man, older adults, younger population, everyone needs some flexibility in their muscles. So, and the time duration for this exercise is everyone has to hold their muscles for 30 seconds, 15 to 30 seconds of stretch to have a proper controlled stretch. It improves joint mobility and relaxation. The final exercise is balance exercise. As we have seen that with diabetes, many older adults, they are at the risk of falling. So one has to and include this balance exercise in the routine. It is like 2 to 3 days per week. It's the same as flexibility exercise. You just have to uh, spend 10 to 15 minutes doing some balance training with single leg standing, like also, you can do on Bosu ball, or when you are at your home, you can do it with some basic support, like holding a chair and like this exercise. This provides a controlled movements. So, and it basically what it means is that it's for fall prevention strategy. Yeah, so older adults, we usually have seen like they are falling in the bathroom or a slippery floor. So this prevents their falling in the day-to-day routine. Now, I will explain that how this exercise supports in your daily living. Why we have to strengthen our specific muscle groups. Number one is a squats exercise. So it basically strengthens your lower limb major muscles like legs, like glutes and hams. So, like daily routine activities like getting out of a chair, coming out coming out from a car, using your toilet independently. These are the examples. Also, wall push-ups. We also need some shoulder strength and arm strength because in a day-to-day routine, we usually like we open doors, we hold some grocery bags and everything, we hold some weights. So we need say upper limb strength too. Now, seated rows. When we are sitting in a couch, when we are sitting on a bed, like we are holding some carry bags, we need this core strength. Also, hill raises. Calf muscle is really an important group of muscles. When we are climbing stairs or we are walking, also we are holding ourselves like standing for longer periods. We need it. Torso twist. Our core muscles are the major powerhouse of the muscles. Like we have to be very strong with the core when we are just doing twisting movements, or while we are driving or we are holding something. Also, hamstring muscle. Hamstring muscles is a major muscle group in the lower limbs. It reduces the stiffness when we are bending or lifting some projects. Thank you.
So now we are going to see a safety. So safety is really important while you are exercising. So the first one is proper technique. So when you are exercising, you need to do it in a proper technique. So that will reduce the risk of injury. And when you are doing it in a correct posture and control movements, it will help to improve your muscles. Another one is safe environment. So when you are doing exercise, just make sure that you have a good lighting and ventilation, and also you have cleared all your space nearby, so you don't fall or anything. Moreover, is pain versus discomfort. So muscle fatigue is normal, but when you feel sharp pain or joint discomfort, stop your exercise immediately. uh, Delayed onset muscle soreness. So mild soreness 24 to 48 hours after exercise is normal. It means your muscles are adapting and getting stronger. Proper gear. So wear supportive clothes, shoes, and comfortable attire. So when you are doing exercise, you feel comfortable. RP scale. So when you are doing exercise, always measure your RP scale and aim for a moderate level, 4 to 6 out of 10 intensity during workout for safe intensity. And when to stop exercise. So if you feel dizzy, lightened, or experience chest pain, sit down, rest, and seek medicine attention if needed. Okay, that's it for today's presentation. Thank you.
Thank you.
Thank you for listening us.
Thank you.